First at 6, fighting the Delta variant.
The highly contagious strain spreading across Arizona, leading some doctors to recommend everyone to mask up. The Delta variant makes up 20% of new COVID cases in the U.S., well above what it was just last month. The CDC says that percentage will just keep going up, expected to double every 2 weeks. That's because researchers estimate that 50 to 60% more contagious than the other known variants out there.
It is a lot to understand, and that's why we have our ABC 15 Health Insider, Dr. Shad Marvasti, with us tonight from the University of Arizona Medical School. And Doctor, you are on record as one of the folks who is now saying people should be wearing masks indoors because of this Delta variant. Is that solely because it's just much more contagious than some of the other strains we've seen?
It's partially because it's more contagious. It's also because of data that we have coming out of Israel in the last few weeks, where half of all the adults that have been diagnosed with COVID and the Delta variant were actually fully vaccinated. And when you look at that, plus the fact that all of our children under 12 are unvaccinated, that same data out of Israel also showed that half of all the people who got COVID in the last few weeks there were actually unvaccinated children. I think there's raises more questions than answers. And especially when we see that there's only a certain percentage of us, 49% or so with one dose, and one dose can be only 33% effective according to data coming out of the UK, where the Delta variant has really took over there.
It sounds like you're saying with some of the emerging data here that this idea of breakthrough cases, that people who are fully vaccinated still getting COVID, that there's a greater risk here. Do you agree with that at this point, or do we need to see more data?
I think we need to see more data, but until we do, because of the fact that there are cases and we are seeing higher rates of hospitalizations, definitely for sure in people who are unvaccinated, but we're seeing more positive cases of breakthrough with people who are fully vaccinated. I think we should take a better safe than sorry approach because it is spreading. As was noted, it's already 20% of cases in the US. It is here in Arizona, and it's doubling every 2 weeks. So until I get more data to feel comfortable about that, I think it's better to protect folks, especially people who have kids at home who are unvaccinated.
We are in a position now where school is starting in a number of districts within a few weeks, and as we know, every child under 12 is still not eligible for this vaccine. You're going to see a lot of pushback if districts try to start recommending masks in school districts. Is that something to recommend, or are children just not as susceptible and not as much of a worry?
Well, they're less susceptible to the original variants and the Alpha variant and the original strains of COVID-19, but we're seeing more cases. Like I said, the data coming out of Israel is particularly concerning. We also saw more children infected in the UK as well with the Delta variant. So because of that, I think, again, a better safe than sorry approach makes sense with wearing masks in school as well.
Dr. Shad Marvasti from the University of Arizona Medical School, thanks so much for joining us. And we know there are a lot of questions about COVID-19. The ABC 15 Health Insider here to help, finding answers to common questions with expert analysis that goes beyond the headlines on the ABC 15 channel. You'll find it on any of these streaming devices.